In this episode, we're going to talk about cell phones and whether or not they cause cancer. I'm going to give you some alternatives to soda, and we're also going to talk about liposuction. Is it unhealthy, and is it worth the risk? This is the Ask Dr. Daniel DC show. All right, first question comes from Nancy. Are cell phones unhealthy or do they cause cancer? Now, Nancy, as with any type of science looking at this type of issue, it's going to really take decades to come to a definitive conclusion. That said, there are certainly more and more studies painting a picture suggesting that cell phone radiation is not completely safe and could very well be carcinogenic. I don't know about you, but I'm practicing the precautionary principle, making simple tweaks in my cell phone usage daily while scientists continue to study the effects of this type of non-ionizing radiation and what it has on our bodies. Remember, people once thought smoking was safe. Today, are we risking good health by using our smartphones in not such smart ways? Now, even though the do cell phones cause cancer debate is not out yet or hasn't been settled, here's what we do know. Cell phone radiation is radio frequency energy and a type of electromagnetic radiation classified as non-ionizing radiation, which is similar to microwaves and radar. Ionizing radiation, on the other hand, is known to cause cancer and includes things like X-rays from the sun as well as radon. Now, the latest evidence suggesting wireless radiation poses a huge public health risk comes from partially released data from a large $25 million well-designed U.S. National Toxicology Program study. Researchers found exposure to very high signal cell phone radiation led to a slightly increased risk of malignant gliomas in the brain and schwannomas of the heart in male rats. Now, schwannomas are tumors that form in the nerve sheath and are actually very, very rare. So if something is increasing the likelihood of these types of conditions happening, then it's got to mean something. The NTP report linking radiofrequency radiation, or RFR, to two types of cancer marks a paradigm shift in our understanding of radiation and cancer risk. The findings are unexpected. We wouldn't reasonably expect non-ionizing radiation to cause these types of tumors. And this is a striking example of why serious study is so important in evaluating cancer risk. It's interesting to note that early studies on the link between lung cancer and smoking had similar resistance, since theoretical arguments at the time suggested that there could not be a link. Now, the study found a dose-response effect. That means that the higher the dose, the higher the risk. And the results backed up previous research suggesting cell phone radiation could increase the risk of gliomas. Acoustic neuromas have also been linked to cell phone use, which are basically neuromas that would be within the brain or in your inner ear. In 2011, the World Health Organization listed cell phone radiation as a 2B carcinogen, meaning it's possibly carcinogenic to humans. Since cell phones have only been in wide use since the 1990s, epidemiological studies looking for long-term risks from cell phone exposure could be missing certain threats that may not be surfacing in humans just yet. And you have to realize that studies looking at cell phone radiation exposure and tumors and other health problems show mixed results, including such as the Swedish researchers, which they found a higher risk for tumors on the side of the head where the cell phone was held, particularly with 10 or more years of use. Whereas most other studies find that brain tumors do not more often originate on the side of the head where people report using their cell phones. Most studies do not show a dose-response relationship as well, meaning that increased cell phone use doesn't seem to increase the risk of brain tumors. Those who begin using cell phones as teenagers, though, have a 4 to 5 times higher chance of being diagnosed with a brain cancer. Sperm, we know, die 3 times faster and experience triple the damage to mitochondrial DNA compared to sperm from men who are not exposed to cell phone radiation. Now, the Environmental Health Trust notes that many studies that do not show an increased risk of tumors are actually shorter studies of 5 or 7 years. And in reality, the organization says that it can take up to 10, if not 30 years for brain tumors to actually develop and show up. So look, common sense will always prevail when it comes to paving the way for personal health protection. Did you know that nomophobia, which is the fear of being without your cell phone, is actually a real thing? With more than 300 million cell phone subscribers in the US and millions of people afraid to have their cell phones literally out of sight or not with them in hand, it's clear that we could actually be on the brink of a major public health crisis if we have to go without our cell phones, or if they actually show that there's a link between cell phones and cancers. Now, whether cell phone radiation causes cancer or not, exposure has been shown to actually impact your body's healthy pH balance, making it more acidic, and we know that that's associated with cancer. Cell phones are also linked to sperm damage, poorer sleep, and even impaired glucose metabolism, meaning that there are other reasons to practice precautionary measures and also to avoid too much cell phone exposure. Finally, we all know that deaths related to cell phone use while driving has dramatically increased. This, hands down, is probably the biggest threat that these devices pose to us. That said, let's look at some of the ways to reduce your exposure to cell phone radiation. Number one on the list is going to be to create distance. Keep your phone farther away from your body by using it as a speakerphone. Electromagnetic radiation is 75% lower when the phone is about 2 inches away, and it's 50 times lower if it's 3 feet away. Number two, keep it out of your pocket. And ladies, don't put it in your bra. That's gross, and it's super unhealthy for your chest. Don't keep your cell phone in your pocket or underneath your pillow at night when you're sleeping. Even when the phone is not in use, it's transmitting data and exposing you to radiation. Number three, text more and talk less. Texting actually reduces the length of radiation exposure. Also, when you push send, the radiation increases dramatically, so maybe push send and then run away. Don't use your cell phone when moving at high speeds. Radiation from your cell phone actually shows that it increases as your phone tries to connect to towers. So when you're traveling at high speeds, say if you're in the backseat of a car or you're on a train or you're on an airplane, there is actually more radiation being emitted. Finally, it's best if we all reduce our exposure to wireless radiation. But for kids, it's an absolute must. Developing children's skulls are actually thinner, and radiation has been shown to penetrate deeper. In fact, sometimes even 75% of the way from one side all the way to the other. Final thoughts. Emerging independent studies suggest cell phone radiation could increase your risk of certain cancers, including malignant gliomas in the brain and schwannomas of the heart. People having only been heavily using cell phones since the 90s, so there's still no definitive proof that they cause cancer, or that they don't. It took decades to prove that smoking cigarettes caused lung cancer. Heck, the American Medical Association and physicians in the 1930s, 40s, and 50s all approved of smoking and stated it wasn't harmful. Since there is evidence cell phones impair sleep and glucose metabolism and increase your risk of cancer, I suggest using the precautionary principle. Take simple steps to keep your phone further away from your body. Next question comes from Brian, a good friend of mine and patient of mine at FHC. Brian wants to know, what are some good alternatives to soda? I say this dozens of times per day, probably hundreds per week to my patients. Soda is toxic stuff. Not only is most of it full of diabetes-inducing high fructose corn syrup, but drinking too much of the bubbly stuff has also been linked to an increased risk of heart attack and stroke, simply because of the amount of sugar. Oh, and if the sugar isn't the reason that you switched to sugar-free, a new Harvard nurse study found that women who consume one diet soda per day increase their risks of leukemia and non-Hodgkin's disease by 50%, and men who consumed one diet soda per day increased their risk of multiple myeloma by 102%. Both regular and diet sodas contain genetically modified ingredients, GMOs, and phosphates, preservatives that have been linked to kidney disease and accelerated aging. Obviously, not something you want as part of your regular diet. But at some point, we all crave something fizzy. And that's no reason to reach for a toxic can of kidney-killing GMO water. We can look high and low for healthy soda alternatives, free of the worst offenders in traditional sodas, such as GMOs or artificial caramel coloring that can be contaminated with carcinogens. But determining why you crave the soda is really the only way that we can avoid them, or at least heal ourselves from them. Answering this question is similar to asking, what is a healthier supplement to heroin that I can take? And I doubt that there is one. People are addicted to soda the same way they're addicted to heroin. Part of it is physical or chemical addiction, and part of it is emotional. Heroin releases large sums of dopamine in the body, and so does exercise. I'm pretty sure a heroin addict wouldn't find the same kind of high from exercise, at least not until they fix their inner self-image of why they want the heroin in the first place. Now, there are alternatives, and these alternatives do not contain sugar, or at least it's a different type of sugar, and they're less processed, but I would still only consume them in moderation. Here are a few store-bought recommendations or alternatives that I would have for you. Stee's carbonated teas, which can be found at Whole Foods and Target. Reed's ginger brew, and there's a variety of different flavors, and these can be found almost everywhere, as well as kombucha. As for doing it yourself, my top soda alternatives would include water infusions, so basically taking some water and throwing some fruit and creating an infusion, and then adding sparkling water, or a jeltzer, which is basically just juice and seltzer. And you can take any of your favorite juices, mix 1 part juice to 3 parts seltzer, and that'll be a nice fizzy treat for you. Finally, you can invest in a carbonated water system like SodaStream. Basically, they turn regular tap water into fizzy water, and then you can flavor it yourself. At the end of the day, when it comes to the ROI of eliminating soda, your life literally depends on it. Okay, last question comes from Tiffany. Is liposuction bad for my body, and is it worth the money? Tiffany, in order for me to really answer that question, we have to look at surgery. And in order for me to recommend surgery, the risk of not getting that procedure needs to be greater than getting it. So honestly, unless your life depends on it, I would advise against any type of surgery, especially elective surgery. Look at it this way. According to a new medical report, liposuction has a mortality rate of 1 in every 5,000 procedures. In contrast, the total death rate for all surgical procedures performed in America is just 1 in 100,000. A patient of mine came to see me a few months back, and basically she said she was concerned about the shape of her thighs. Then she asked about having a spot of liposuction, as if it were something as simple as just having her teeth polished, right? Or removing a spot or a blemish on her tooth. It blows my mind how we can assume that procedures like liposuction are just in and outs, and I believe it's because the media has made it so. Like this patient of mine, an increasing number of people consider cosmetic surgery to be a quick fix solution. It may sound like a minor procedure, but people should be warned that it can go wrong, or that a lot can go wrong, and there are enormous risks involved. Liposuction often involves far more than just sucking away fat, and as with any operation, it doesn't always go according to plan. Things can and sometimes do go wrong in surgery. The operation can be performed under a local anesthetic combined with sedation, or for larger areas, a general anesthetic may be used. Though nowadays complications from intravenous sedatives or general anesthetics are rare, patients who are overweight and therefore more likely to have liposuction are slightly more at risk for any kind of surgical procedure. Liposuction is not a gentle procedure by any means. Initially, a cold salt solution, which also contains adrenaline, and a local anesthetic is literally injected into the fat cells. Next, a large hollow needle, usually about 3 millimeters in diameter, which is attached to a powerful suction machine, is inserted in turn through several small cuts in the skin. It is passed into the pockets of fat where it is moved around with considerable force, and this fat is quite solid, and so it needs some liquidizing in order to be sucked into the cannula or the draining tube. The saline solution helps to loosen and liquidate the fat, but it can cause problems as well. Removing a large amount of fat can lead to a dramatic loss of body fluid and a sudden drop in blood pressure, so it is important that this fluid is replaced. But it is also vital to get the balance right. Giving too much fluid can also be dangerous and cause kidney problems. Worse, still, the local anesthetic that the fluid contains can cause irregularities in heartbeat, which can be fatal. Inevitably, the way the operation is performed damages blood vessels, which can lead to a considerable loss of blood. The risk of hemorrhage is greater when large volumes of fat are removed, and most surgeons actually recommend that no more than 3 liters of fat be removed at any time. Even if the operation goes well, It can cause pain and stiffness afterwards. The result of the operation may not be immediately apparent either, as some people report that it can even be 6 months to 8 months after before you experience any kind of change. And the swelling is quite common and may take up to 6 months to settle completely. Infection at the operative site is probably the well-known risk, and while this can usually be treated with antibiotics, it is painful and can increase the risk of horrible scarring afterwards. Liposuction can result in deep infections, which have been known to cause extreme disfigurement. However, the major risk from the surgery is actually the formation of a clot, or a thrombosis, in a vein in one of the legs, and this clot can move up into the lungs, becoming a pulmonary embolus, or embolism. Small pieces of fat that pass into the bloodstream, fat emboli, can also be extremely dangerous and are the most common cause of death after liposuction due to stroke. So is it unhealthy? In my opinion, yes. Is it worth the money? I think the better question is if it's worth the risk and the money. We've already reviewed the risks. Now, as far as how much you pay, that obviously depends on the clinic that you go to. And the average cost of these procedures is somewhere between $3,000 and $7,000. And according to the most recent studies, approximately 40% of people who undergo liposuction gain the weight back in a year, and sometimes in weird places. It does seem that the satisfaction rate for liposuction is very high when women have liposuction of their thighs, bellies, and necks. But like a bad dream, that fat has a way of sneaking back into your body, and often in places that you don't really want. By a year after surgery, most people who have liposuction of their thighs wind up with more fat in their bellies. And if it was the tummy that was suctioned, don't be surprised to find chubbier arms a year later or chubbier thighs a year later. Also, nearly all liposuction patients weigh the same a year after surgery as they did before the actual surgery. Our bodies seem to fight to get that fat back. And that's because thousands of years ago, people could store fat, lived longer when no food was around. So sure, liposuction will work, but to keep that fat down from returning, you still have to diet and exercise. There is really no fooling Mother Nature. Okay, that does it for episode number 9 of the Ask Dr. Daniel DC show. Again, I hope you guys are enjoying the information. If you have questions, keep them coming. As long as you're submitting questions, I'm going to keep making shows. If you have not done so, please subscribe to this YouTube channel. You can friend me on Facebook at /Dr. Daniel DC. You can follow me on Instagram at Dr. Daniel DC. You can also find me on Snapchat. I've been Snapchatting lately, where I give a lot of health tips daily and health facts. Look me up. My username is Dr. Daniel DC. We'll see you guys at the next episode.